This show is part of One Place, a daily network of focused briefings across the stories people follow most.
Welcome to our daily roundup. Today we explore how childhood stress reshapes the gut and why using AI for advice might actually offend your doctor or financial planner. Let's get started.
Early childhood stress may cause lifelong digestive issues.
Consulting AI for advice can damage professional relationships.
Outdoor athletes possess superior peripheral color detection skills.
Narcissism and celebrity worship drive problematic Instagram scrolling.
Evidence for cannabis treating mental health remains very sparse.
Cannabis fails to improve depression or anxiety symptoms.
UK teenagers face calls for expanded meningitis vaccinations.
Psychiatrists may soon use biological markers for diagnoses.
Doctors often use search engines to verify medical information.
U.S. smoking rates hit a historic low under 10%.
First, childhood stress impacts health.
New research from New York University suggests that childhood stress doesn't just affect the mind, it may quietly reshape the gut for life. Scientists found that early life adversity, such as emotional neglect, can disrupt the gut-brain connection, leading to long-term issues like irritable bowel syndrome, chronic abdominal pain, and motility problems. This study, published in Gastroenterology, highlights how the sympathetic nervous system and the gut communicate constantly. When the brain is impacted by early trauma, the gut often follows suit, creating physical symptoms that persist well into adulthood.
The study utilized both mouse models and data from thousands of children to pinpoint specific biological pathways. Interestingly, researchers discovered that different pathways control different types of gut issues, which could lead to more personalized treatments in the future. Dr. Kara Margolis, the study's lead author, emphasized that understanding these mechanisms is crucial for creating targeted therapies. This research serves as a powerful reminder that a child's early environment has lasting physical effects, not just emotional ones, and that the gut-brain axis is a critical component of overall pediatric development.
Next, AI and professional trust.
Consulting artificial intelligence for a second opinion might seem like a smart move, but it could be straining your relationships with human professionals. A study in Computers in Human Behavior found that human advisors, like financial planners or nutritionists, feel less motivated to work with clients who use AI to verify their advice. In 4 different experiments, researchers observed that advisors often felt insulted when their expertise was compared to a computer algorithm. This reaction was actually stronger than when a client sought a second opinion from another human expert, suggesting a unique tension with technology.
The researchers, Gary Spasova and Mauricio Palmera, noted that this negative response is tied to professional identity. Because experts view AI as less capable than trained humans, being placed on the same level as a machine feels like a lack of trust or respect. Furthermore, the study revealed that advisors tended to judge clients who used AI more harshly, viewing them as less capable of making their own decisions. As AI becomes more integrated into daily life, these findings suggest that we need to be mindful of how we communicate our use of technology to maintain professional rapport. Now, athletes and peripheral vision.
If you play outdoor sports, you might literally see the world differently than everyone else. A study published in the journal Perception found that outdoor athletes have superior color detection in their peripheral vision compared to indoor athletes and non-athletes. This suggests that training in large, open environments can physically shape how the brain processes visual information. While the center of our vision is naturally better at detecting color and detail, athletes who must monitor teammates and opponents across a wide field seem to develop enhanced sensitivity at the very edges of their visual field through practice.
This discovery challenges the idea that basic sensory functions like color perception are hard-coded from birth. Instead, it provides evidence for perceptual learning, where the adult brain retains the ability to adapt based on real-world experiences. The researchers isolated pure visual perception to ensure athletes weren't just reacting faster, but actually seeing better. This suggests that the demands of a specific environment, like a massive soccer pitch or a football field, can push the human visual system beyond its typical biological limits, proving that our brains are much more plastic than previously thought throughout adulthood.
Moving to Instagram habits.
New research in the Journal of Psychology has linked narcissistic traits and celebrity worship to problematic Instagram use. The study found that individuals who obsess over famous figures or have an inflated sense of self-importance are more likely to develop addictive scrolling habits. This behavior is often driven by an underlying fear of missing out, or FOMO, and a struggle to manage difficult emotions. Instagram's highly visual nature provides the perfect stage for narcissists to seek admiration, while its constant updates feed the obsession of celebrity worshippers, leading to a cycle that can disrupt daily life and offline relationships.
The research team, led by Hadi Fazlirad, used a psychological framework to show how personality traits combine with emotional responses to create these addictive routines. Problematic use goes beyond just spending a lot of time on the app. It involves mood alteration, withdrawal symptoms, and building a tolerance where users need more screen time to feel satisfied. By identifying these specific vulnerabilities, the study helps clarify why some people are more susceptible to social media addiction. Understanding these roots is the first step in developing better strategies for digital wellness and helping users regain control over their social media consumption.
Next, cannabis and mental health.
Despite the widespread belief that cannabis can help with mental health, a massive review of 45 years of research suggests there is little to no high-quality evidence to support this. The analysis, published in The Lancet Psychiatry, looked at over 50 clinical trials and found no proof that cannabis effectively treats symptoms of anxiety, depression, or PTSD. These are the very conditions for which many medical marijuana users seek relief. Lead researcher Jack Wilson noted that the public's enthusiasm for cannabis has far outpaced the actual scientific data, leaving a significant gap in our understanding of its true efficacy.
The study did find some low-quality evidence for conditions like insomnia and Tourette's syndrome, but even those results were not robust. One major hurdle has been the long-standing federal classification of cannabis as a Schedule I drug, which has historically made it difficult to fund and conduct high-quality trials. Even as states legalize it, the investment in rigorous medical studies hasn't kept up. This lack of evidence means that routine use of cannabis for psychiatric disorders is rarely justified by current science. Researchers are calling for more coordinated, high-quality studies to finally determine if these products have any real therapeutic value.
Continuing with cannabis research.
Building on the previous story, a comprehensive meta-analysis has further confirmed that cannabis-based medicines fall short in treating most psychiatric disorders. While some people report mild relief, the data shows that these products do not significantly improve conditions like depression or anxiety, and often come with a higher risk of side effects. This is particularly concerning given that nearly 27% of people in the US and Canada use cannabis for medical reasons, with half of them targeting mental health issues. The surge in prescriptions for cannabinoids has largely occurred without the backing of solid clinical evidence, creating a potential public health risk.
The research team at the University of Sydney used a systematic review to gather data from the past 4 decades, aiming to bridge the gap between clinical use and scientific proof. By combining numerical data from various studies into one large statistical model, they were able to see a much clearer picture of the drug's actual impact. Their findings suggest that the current trend of prescribing cannabis for mental health struggles is not yet justified by science. This highlights an urgent need for clinicians and patients to be more cautious, and for the medical community to prioritize rigorous testing over anecdotal success stories.
Now, meningitis vaccines in UK.
In the UK, a recent outbreak of meningitis B in Kent has sparked a debate over why teenagers aren't routinely offered the MenB vaccine. While babies have been vaccinated since 2015, the current generation of university students missed out because the shot wasn't available when they were born. MenB is a rare but very serious bacterial strain that can lead to sepsis, brain damage, or death. Currently, teenagers receive the MenACWI vaccine, which protects against other strains but leaves them vulnerable to MenAC. This gap has left many parents feeling forced to pay for private vaccinations to protect their children.
The Health Secretary has now asked advisors to re-examine the eligibility for meningitis vaccines in light of the recent deaths in Canterbury. A small, targeted vaccination program is starting for students in specific residence halls, but many are calling for a wider catch-up campaign. Bereaved parents have shared heartbreaking stories, noting that they would have paid for the vaccine in a heartbeat if they had known the risks. As the UK Health Security Agency assesses the ongoing danger, the priority remains encouraging those offered antibiotics to come forward, as this is highly effective at preventing the spread of this devastating disease.
Shifting to mental health biomarkers.
Psychiatry may be on the verge of a major shift toward using biological markers for diagnosis, similar to how other medical fields use blood tests or imaging. Historically, mental disorders have been diagnosed based on visible symptoms, but the American Psychiatric Association is now exploring how to incorporate biomarkers into future versions of the DSM. This move was inspired by cases like Amanda Miller, a neuroscientist whose severe depression only improved after a blood test revealed high autoimmune markers. Once her lupus was treated with steroids, her mental health symptoms vanished, suggesting that underlying physical inflammation was the true culprit behind her psychological struggle.
While the potential for biomarkers is exciting, the APA emphasizes that they are not yet ready for widespread clinical use. Decades of research have yielded few reliable indicators that are consistent enough for daily practice. More coordinated research is needed to ensure these tests are valid and cost-effective before they can be officially added to the Bible of Psychiatry. However, the inclusion of these ideas in official documents marks a significant step toward a more integrated approach to mental health, where biological data could eventually help doctors choose the right treatments more quickly and avoid the trial and error process of prescribing medication.
Next, doctors using Google.
It might be unsettling to see your doctor use Google during an appointment, but one physician-turned-patient argues that it's actually a sign of good care. After surviving a series of medical errors and a brain tumor, this doctor realized that a good bedside manner is often more important than a clinician's ability to recall every fact from memory. Kindness and inclusivity encourage patients to participate in their own care, which can lead to better health outcomes. When a doctor looks something up, it shows they are being thorough and upfront about the need to double-check information, rather than being dismissive or relying on outdated knowledge.
The reality is that clinicians in hospitals and specialist clinics look things up all the time. They just might not do it right in front of the patient. The author suggests that we should value honesty and empathy over the image of an infallible expert. Clear, reassuring communication can help ease a patient's anxiety and improve their adherence to treatment plans. By straddling the line between being a provider and a patient, this doctor learned that the human connection in medicine is just as vital as the clinical facts, and that a quick search can be a tool for better, more accurate care.
Finally, falling smoking rates.
For the first time in recorded history, the adult smoking rate in the United States has fallen below 10%. In 2024, only 9.9% of adults reported smoking cigarettes, down from 10.8% the previous year. This is a massive public health milestone, yet the news didn't come from a government announcement. Instead, it was published as a public health alert in a digital journal by a former CDC scientist. This highlights a growing gap in government-led health surveillance, as budget cuts have decimated offices responsible for analyzing and reporting this critical data, leaving independent researchers and universities to fill the void.
While cigarette use is down, e-cigarette use remains steady at 7%, and smokeless tobacco use was reported at 2.6%. The decline in traditional smoking is a symbolic victory for public health, but the lack of official government reporting raises concerns about the future of tobacco control and education. Independent initiatives like the Vaccine Integrity Project are also emerging to protect public health data amid these government shifts. Despite the lack of a federal fanfare, the data from the National Health Interview Survey confirms that the decades-long effort to reduce smoking is working, even as the methods for tracking that progress are changing.
That's our program for today. Be sure to follow us for your next daily briefing. We will see you back here tomorrow.